1. What is the priority nursing action when preparing to assist a patient with ambulation after surgery? Answer. Use a gait belt and provide support during ambulation. Rationale. A gait belt ensures patient safety by providing stability and preventing falls during ambulation, especially post-surgery when patients may be weak. Support promotes confidence and reduces injury risk. 2. What is the most important step the nurse should take before administering a medication to a patient? Answer. Verify the patient's identity using 2 identifiers. Rationale. Verifying identity with 2 identifiers, e.g., name and date of birth, ensures the right patient receives the medication, aligning with the 6 rights and preventing errors. 3. What is the nurse's priority action when entering a patient's room with contact precautions for C. difficile? Answer. Don a gown and gloves before entering the room. Rationale. Contact precautions for C. difficile require a gown and gloves to prevent pathogen transmission. This protects the nurse and other patients from infection. 4. What should the nurse do first when a patient refuses a prescribed medication? Answer. Document the refusal and notify the healthcare provider. Rationale. Respecting patient autonomy, the nurse documents the refusal and informs the provider to address the issue, ensuring continuity of care and legal compliance. 5. What is the best position for a patient receiving enteral feeding to prevent aspiration? Answer. Elevate the head of the bed to 30 to 45 degrees. Rationale. Elevating the head of the bed reduces the risk of aspiration by promoting proper digestion and preventing reflux of enteral feeding into the esophagus. 6. What is the nurse's priority action when a patient reports pain at a level of 8/10? Answer. Assess the pain's characteristics and location. Rationale. Assessment is the first step in the nursing process, allowing the nurse to determine the cause and appropriate intervention for effective pain management. 7. What is the most appropriate task to delegate to a certified nursing assistant, CNA? Answer. Assist the patient with bathing and grooming. Rationale. Bathing and grooming are within a CNA scope of practice, promoting patient hygiene while allowing the nurse to focus on tasks requiring clinical judgment. 8. What should the nurse do to maintain a sterile field during a dressing change? Answer. Use sterile gloves to handle sterile supplies. Rationale. Sterile gloves maintain the integrity of the sterile field, preventing contamination and reducing the risk of infection during the procedure. 9. What is the nurse's first action when responding to a fire alarm in the hospital? Answer. Follow the RACE protocol, rescue, alarm, contain, extinguish/evacuate. Rationale. The RACE protocol ensures a systematic response to fire emergencies, prioritizing patient safety and effective containment or evacuation. 10. What is the most important teaching point for a patient on fall prevention at home? Answer. Remove throw rugs and clutter from walkways. Rationale. Removing hazards like throw rugs and clutter reduces the risk of tripping, a common cause of falls, especially in older adults. 11. What is the correct technique for assessing a patient's apical pulse? Answer. Place the stethoscope over the 5th intercostal space at the midclavicular line. Rationale. This location corresponds to the apex of the heart, where the apical pulse is most accurately assessed for rate and rhythm. 12. What should the nurse do to ensure proper hand hygiene before patient contact? Answer. Wash hands with soap and water or use alcohol-based sanitizer for at least 20 seconds. Rationale. Proper hand hygiene removes pathogens, reducing infection risk. A minimum of 20 seconds ensures effective decontamination. 13. What is the priority nursing action for a patient with a new tracheostomy? Answer: ensure the tracheostomy tube is secure and patent. Rationale: a secure and patent tracheostomy tube is critical to maintain airway patency, preventing respiratory distress or obstruction. 14. What is the nurse's best response when a patient asks about the purpose of a low-sodium diet? Answer: explain that it helps reduce fluid retention and manage blood pressure. Rationale: a low-sodium diet reduces fluid overload and hypertension, improving cardiovascular health and preventing complications like edema. 15. What should the nurse do first when a patient is found unresponsive in bed? Answer: check for responsiveness and assess breathing. Rationale: assessing responsiveness and breathing is the first step in the chain of survival to determine if CPR or other interventions are needed. 16. What is the most important action when administering an intramuscular injection? Answer: aspirate the syringe to check for blood return before injecting. Rationale: aspiration prevents injection into a blood vessel, reducing the risk of complications like emboli or medication toxicity. 17. What is the nurse's priority action when a patient with a history of falls attempts to get out of bed? Answer: apply a bed alarm to alert staff. Rationale: a bed alarm promotes safety by notifying staff of unassisted movement, allowing timely intervention to prevent falls. 18. What is the best way to communicate with a patient who speaks limited English? Answer: use a certified medical interpreter. Rationale: a certified interpreter ensures accurate communication, reducing errors and respecting cultural competence in patient care. 19. What should the nurse include in documentation after administering a medication? Answer: record the medication name, dose, route, time, and patient response. Rationale: accurate documentation ensures continuity of care, legal compliance, and monitoring of therapeutic effects or adverse reactions. 20. What is the priority intervention for a patient with a fever of 102 degrees Fahrenheit? Answer: administer an antipyretic as ordered. Rationale: antipyretics reduce fever, promoting comfort and preventing complications like seizures, especially in high fevers. 21. What is the correct technique for measuring a patient's blood pressure? Answer: position the cuff 1 inch above the antecubital fossa with the arm at heart level. Rationale: proper cuff placement and arm positioning ensure accurate blood pressure measurement, avoiding false readings. 22. What is the nurse's priority action when caring for a patient on strict bed rest? Answer: reposition the patient every 2 hours. Rationale: repositioning every 2 hours prevents pressure ulcers by relieving pressure and promoting circulation in immobile patients. 23. What should the nurse do to promote comfort for a patient with a new cast? Answer: elevate the affected limb to reduce swelling. Rationale: elevation minimizes edema, reduces pain, and promotes circulation, enhancing comfort and healing. 24. What is the most important teaching point for a patient with a new colostomy? Answer: monitor the stoma for a pink, moist appearance. Rationale: a pink, moist stoma indicates healthy tissue, while changes may signal complications requiring medical attention. 25. What is the nurse's priority action when a patient reports nausea after eating? Answer: assess the characteristics and onset of the nausea. Rationale: assessment identifies potential causes, e.g., medication side effects, food intolerance, guiding appropriate interventions. 26. What is the correct method for cleaning a wound during a dressing change? Answer: clean from the center of the wound outward in a circular motion. Rationale: Cleaning outward prevents introducing pathogens from surrounding skin into the wound, reducing infection risk. 27. What should the nurse do to ensure safety during oxygen therapy? Answer. Post a no smoking sign near the patient. Rationale. Oxygen is flammable, and a no smoking sign prevents fire hazards, ensuring patient and staff safety. 28. What is the nurse's priority action when a patient with a urinary catheter reports discomfort? Answer. Check the catheter for kinks or blockages. Rationale. Kinks or blockages can cause discomfort and urinary retention, so inspection ensures patency and patient comfort. 29. What is the best way to assess a patient's respiratory status? Answer. Count the respiratory rate for 1 full minute. Rationale. Counting for a full minute provides an accurate baseline of respiratory rate, detecting abnormalities like tachypnea or bradypnea. 30. What should the nurse teach a patient about proper body mechanics when lifting? Answer. Keep objects close to the body and bend at the knees. Rationale. This technique reduces strain on the back, preventing injury and promoting safe lifting practices. 31. What is the priority action when preparing to insert a urinary catheter? Answer. Maintain sterile technique during insertion. Rationale. Sterile technique prevents urinary tract infections, a common complication of catheterization, ensuring patient safety. 32. What should the nurse do first when a patient with a nasogastric tube reports abdominal distension? Answer. Check the tube for patency and placement. Rationale. Verifying patency and placement ensures the tube is functioning correctly, preventing complications like distension or aspiration. 33. What is the most effective way to prevent pressure ulcers in a bedridden patient? Answer. Use a pressure redistributing mattress. Rationale. A specialized mattress reduces pressure on bony prominences, preventing ulcer formation in immobile patients. 34. What is the nurse's priority action during a code blue? Answer. Begin chest compressions if the patient is pulseless. Rationale. Chest compressions restore circulation in cardiac arrest, following ACLS guidelines and prioritizing life-saving intervention. 35. What should the nurse teach a patient about a high-fiber diet? Answer. Increase intake of whole grains, fruits, and vegetables. Rationale. These foods are rich in fiber, promoting bowel regularity and preventing constipation, a key dietary goal. 36. What is the correct technique for administering eye drops to a patient? Answer. Drop medication into the lower conjunctival sac. Rationale. The conjunctival sac is a safe site for eye drop administration, minimizing corneal damage and ensuring effective delivery. 37. What is the nurse's priority action when a patient with limited mobility reports leg pain? Answer. Assess for signs of deep vein thrombosis, DVT. Rationale. Limited mobility increases DVT risk, and leg pain may indicate a clot, requiring immediate assessment to prevent complications. 38. What should the nurse do to ensure accurate documentation of a patient's intake and output? Answer. Measure and record all fluids consumed and excreted. Rationale. Accurate measurement of intake and output monitors fluid balance, detecting abnormalities like dehydration or overload. 39. What is the best way to promote therapeutic communication with a patient who is anxious? Answer. Use open-ended questions and active listening. Rationale. Open-ended questions encourage the patient to express concerns, while active listening builds trust and reduces anxiety. 40. What is the nurse's priority action when a patient's foresight shows signs of infiltration? Answer: stop the infusion and remove the forecatheter. Rationale: stopping the infusion and removing the catheter prevents further tissue damage from fluid leaking into surrounding tissues.